Could you imagine going through your entire life having no sense of reality? Well, that's what it's like for someone who is suffering from schizophrenia. So schizophrenia, according to the National Institute of Mental Health, is a serious mental health disorder with a wide range of symptoms that can affect every aspect of a person's life. So according to the Mayo Clinic, there are some risk factors associated with developing schizophrenia. And these are family history. So if anyone going all the way back to your grandparents, great-grandparents had schizophrenia, you have a higher chance of developing it. Another one would be increased immune system activation. Another one is older age of the father. So if your father was older, above like 50 or so when you were born, you have a more increased chance of developing schizophrenia. Another is certain pregnancy complications. And then the last one is taking psychoactive or psychotropic drugs while you are a teenager. So there are 4 different ways to diagnose schizophrenia according to the Mayo Clinic. These are a physical exam, so this would look at both your physical well-being and your cognitive well-being. The next is tests and screenings. So these are brain tests and different screenings such as MRIs, CAT scans, PET scans, all these different things to look at different aspects of your body. Another one is a psychiatric evaluation. So this would be meeting with a psychiatric professional, and they would go through questioning and they would look at your life and different aspects of it and look at different symptoms you're suffering from to see if you have schizophrenia. And then the last one is a diagnostic criteria for schizophrenia. This is a direct list. If you meet the things on this list, then you do have schizophrenia. If you do not meet them, you don't. It is very exact. So there are 3 types of symptoms according to the National Institute of Mental Health. These are positive symptoms, negative symptoms, and cognitive symptoms. So positive symptoms, well, there are 4 different things underneath this. That would be hallucinations, which are picturing something that is not really there, delusions, thought disorders, and movement disorders. And there are negative symptoms. There's the flat effect, so that is just you are flat, you have no emotion, you don't have spikes in emotion, drops in emotion, you are just there, you're pretty much numb to the outside world when it comes to emotions. The next is reduced feelings of pleasure in everyday life. So this would be things that normally make you happy. Say your favorite thing to do is see a cat or ride a roller coaster. Rather than that making you happy and sparking joy in your life, you would just feel numb. You would feel nothing when it came doing that. The next one is difficulty beginning or sustaining activities. So this would be doing things such as sports or other extracurricular activities. You would have no desire to do them and you'd have a really, really hard time while they're doing them. And then the last one is reduced speaking. This is a big one for people suffering from schizophrenia. Most of them do not speak or have very minimal communication with their parents, their friends, their teachers, their counselors. It's very big for them. All right. And the last type of symptom, cognitive symptom, there's 3 different things to go along with this. That's poor executive functioning, trouble focusing or paying attention, and problems with working memory. So the problems with working memory is that they have a really hard time remembering things, whether it be from yesterday or 2 years ago. They forget, they're very forgetful, and they have a hard time keeping up with what's going on in their life. So treatment. According to the National Institute of Mental Health, people with schizophrenia will have to go through treatments for their entire life. So there are 3 different types of treatments. These are antipsychotics, which are the drugs and pills that you think of when you think of a treatment for an illness. Then there's psychosocial treatment, so this is working with a counselor or medical professional and trying to work through some of your problems. And then there's coordinated specialty care. So this is pretty much more intense. A lot of times you are in a permanent treatment facility and working with people every day of your life. So future treatment. According to Chris Fellner, there are 3 major types of treatment, all aimed at reducing the negative symptoms that we'll be seeing for schizophrenia in the future. These are very important because although we do have treatments currently, they are not as effective as they need to be. All these people that are getting treated will continue to have to get treated, and it really takes away from their life, and they can't live a normal life and have our idea of a good well-being. So the 3 types of treatments are intracellular therapies, ITI-007, Minerva Neuroscience, which is MIN-101, and TeneoRx, which is also known as NAVEN. And then these are my references.